Okay, we've got people in?
Yeah.
Lovely. Good afternoon, everybody. Welcome. Thank you for joining us this afternoon. Appreciate it. It's Friday afternoon after a long week. My name's Caroline Trevithick. I'm the Chief Nurse for the Leicestershire Clinical Commissioning Groups and the lead for the vaccination programme across Leicestershire. A couple of housekeeping things, if I might. Can we ask you to go on mute if you're not speaking? We'll unmute you if you want to come in and ask questions. You can unmute yourself when you want to ask questions. And we are recording this so that we can share it with your colleagues who aren't able to join us today, and I hope that's okay. The way we're going to run this afternoon, we've got some people doing some, well, we've got Sarah Ward from the Leicester Partnership Trust, who some of you may know from the Trust. She's going to walk us through the slides that you can see on the screen now. And we've got Laura French from the local authority in Leicester City. And then I've got some comms colleagues with us as well who are going to be sorting us out in the background. So we're going to go through these slides first, and then we've got opportunity for you to ask questions. But also you can use the chat if you're familiar with the chat on Zoom, so you can put questions in the chat. We can answer those as we go along if we can. If not, we'll definitely cover those. And if after the presentation, if you want to ask any questions, then just raise your hand to ask questions. So without further ado, I'll hand straight over to Sarah and we'll take you through the slides and you can hear all the information we've got to share with you. Thanks. Thanks, Sarah.
Okay, thanks, Caroline. So just to reintroduce myself, my name's Sarah Ward and I'm the operational lead for the Children and Young People's COVID programme in particular. So that's my role. So I'm just going to talk you through the slides, and then, as Caroline said, there'll be an opportunity to ask the panel some questions as well as using the chat facility. So the first slide just really gives you some information about COVID. So I'm sure you're probably familiar with all of this information on this slide. So that really sums up that it's a very infectious respiratory disease and gives you a little bit more information in terms of the vaccination programme. Next slide, please. Okay, so really this is the bit that you probably want to know. So how are we planning to run the vaccination sessions in school? So the plan is that we will visit the schools across Leicester, Leicestershire and Rutland, and we will be offering all children aged 12 to 15 the COVID vaccination. The Pfizer vaccine is the one that we'll be offering. The aim is that we'll run the sessions. We've started the sessions. They started on Wednesday of this week and will run into early November. In addition to offering in schools, just to say that the clinically extremely vulnerable children, you might be aware that we have already offered vaccine to those children, and that has been offered in hospital settings.
Have a great weekend.
You too.
Okay.
Bye, everyone.
Okay, it's okay, so we can do here just a little bit of background noise there. Okay, so what we've done is we've issued you with a letter. So a letter's gone to all the schools and a consent form that we've asked you to share with.
I think you've been muted by mistake, Sarah. So can you try and unmute, do you think? That's it.
I'm back. The joys of Zoom. Okay, so we've issued letters to all the head teachers and asked that the head teachers share those with the parents. And what we are doing is really encouraging parents, carers to have conversations with the children before completing the form and returning it. But clearly, you know, we are wanting the consents to be returned as soon as possible due to the speed that we are sort of mobilising the programme. Next slide, please. Okay, so how are we planning to run the vaccination sessions in school? So the emphasis of this programme is very much on the school age immunisation team. These are very experienced practitioners that have been delivering programs in schools for many years, so they really are experts in what they do. So you'll be hopefully familiar with previous programs, HPV, teenage boosters. So we come in, our trained vaccinators come in on the day. There's a team, there's usually some admin support, some support with watching the children post-vaccination, but we will come in on the day, a full team, tend to take over a space that you've allocated for us, which is really appreciated. And then what we do is we really ask that you work with us so we can get through as many children as possible on the day that we're there. We appreciate that the school day is a shorter day to what we're probably used to, but we try and work with you around breaks, lunchtime, etc. Okay, thank you. Just to say, actually, before we just move on, because of the nature of mobilising the programme, we appreciate that there were programmes planned in and we've switched, which, you know, I know is probably a little bit tricky for some people to get their heads around, that, you know, the parents thought that the child was going in for the HPV vaccine, but actually we were offering COVID. So it was a very quick turnaround, but that is what we're doing. And then HPV will be offered at a later date, but we'll still be offering the flu later in the year, and that's the extended flu programme. Thank you. Next slide. Okay, so just some frequently asked questions. So what's the school's role? Like I say, I'm sure many of you are familiar with us coming into your schools, but it's what we ask is that you provide information to the immunisation service where requested, and we work together. We ask that you share the information with the parents, the consent forms, the invitation letters with the parents, and also then with the children. Sharing these in a timely manner allows for those conversations that, again, we really encourage between parent, carer, child. And then we ask for a space where at all possible that, you know, causes less disruption to you, but equally meets the needs of a vaccination programme. So that's our ask. Thank you. Next slide. Okay, so just the more frequently asked questions, what facilities do we need to provide? So what we're looking at is enough space for at least 6 staff to have a workstation each. Okay, this may be a challenge for some schools, but we do ask that, you know, the more space as possible, because clearly we're expanding the teams to try and deliver this programme. So the bigger our teams can be, the more children we can get through on the day. So where possible, we would ask for you to consider maybe a different space to perhaps what we've used previously. And then we are asking that we obviously have consideration for social distancing, and our infection prevention control is clearly very important to us. So we would ask for hand washing facilities to be nearby. Okay. So will young people have to wait to be observed? Absolutely they will. So following the Pfizer vaccination, children will need to wait for 15 minutes. So we have dedicated staff that will watch the children. Different staff use different methods, but usually it will be a little piece of paper that says you're free to go at, and with a time on it, so they know when they can return to class or to their peers. But we will absolutely need an area where we can observe the students for 15 minutes post-vaccination. Okay, next slide, please. Okay, so eligibility. So as I previously said, we'll be offering the vaccine to all children aged 12 to 15, and it's 1 dose of the Pfizer vaccine that we're offering. So children who are 12 years and over on the day will be offered the vaccine. Anybody that isn't 12, a day before their birthday, unfortunately, will not be offered the vaccine on the day that we visit the school. Okay, children aged 16 to 17, as you are probably aware, there is an ongoing offer for children aged 16 to 17 to attend a vaccination centre. Some of the GPs are hosting sites, etc. So that's an ongoing offer, which includes booking sessions and walk-in sessions, and that's for the 16 to 17-year-olds. And they again are being offered 1 dose of the vaccine. Next slide, please. Okay, So how do we deal with anti-vaxxers and protests at our school? Okay, so we take this very seriously, and I do appreciate that this has been a concern for many of you. What we would say is that, you know, we are often alerted if there is going to be a planned demonstration. So we do liaise with police. We obviously have links within our organisation that we liaise very closely with, and we would ask that you know, contact the police, local authority if there are to be any concerns. But if you are concerned, you know, please do speak to us and we can go through that in more detail. We will be increasing our communications on social media and through the press to make it clear that we will be offering this vaccination programme. So just so you know that that is one of our ways that we do communicate with parents, carers, to promote what we think is the best thing that we're doing. Thank you. Next slide. Okay. So what information can parents, young people access about the vaccine to help them make an informed decision? Again, this comes back to me really emphasising the fact that we really support that parents, carers have those conversations with the child, young person. In addition, as I've just said, there is social media, which we know all children, young people are very keen on. There's the Health for Teens website that's got some very useful information on. We'd encourage you to visit the national government website, so trusted websites, e-leaflets that can be shared, online videos and press releases. Okay, so some of the items that are mentioned above are currently being produced and regularly updated, you know, and that's because we kind of listen to feedback, respond, we involve youth advisory boards, and we take on board suggestions and adapt our material to the needs of the people that we're serving. Next slide, please. Okay, I'll hand back to Caroline at that point. Thank you very much for listening to the brief presentation. Thank you.
Thank you very much, Claire. That's really, really helpful, really concise there. Lots of information for you, though. So I'm just looking at the chat. I can't see anything. If you want to raise your hand, and if you're not familiar with Zoom, but don't worry, we had this with the heads yesterday. So at the bottom of the screen, there's the reactions button, and on there's an opportunity to raise your hand, or you can laugh, cry, send us messages. But does anybody have any questions in terms of what we've talked about, or something that you may not have heard, or that you've heard differently from what Sarah said, and that you want to clarify anything? And from our perspective, it's really important that we get these messages over to you, because we want to help you help us make sure that these vaccination sessions go really smoothly. Because as Sarah said, you know, we've got a really short timescale to do this. The government has set us some quite impressive targets to achieve. So we're cracking on through it really, really quickly. Question in the chat: you've looked at the sample letters to parents. How do we get the date to insert into the letter? So Sarah, do you know how we're sharing dates?
That's a technical question, isn't it?
It certainly is.
No, yeah, I'll do my best. My understanding was that with the letter that was sent out, the date was actually given to the schools. So I'm not quite sure if that's one that's been missed, but that should have been inserted. There was a few that might have said to be informed at a later date, but that was the minority. My understanding was that majority. So possibly we might need to take that one back and sit and relook at the schedule.
So that's from, I think, a date. Sorry if I pronounced that wrong, but I think if you haven't got that date in the school, if no one in the school has got it, then please come back to us and tell us. We've got something from Nike. What time are you arriving at the school?
Yeah, okay, so basically we arrive at the school around 8:30 in the morning, but it takes quite a while to set up, because we have to set up all the IT equipment as well as all the kind of, you know, the vaccination equipment. So generally the teams will start to arrive about 8:30 to aim to start vaccinating about 9:30, but we work with the school really in terms of what time is appropriate to start, but the sooner we can start, the better from our perspective. Yeah,
thanks, Sarah. And we had a conversation with some of the schools with more complex children in there, that it's really important that we do that in conjunction with the school, so that we cause as little disruption as possible. The programme is going to disrupt, there's no two ways about it, but particularly with some of our children who this is going to really upset, we need to make sure that we do that in as sympathetically as we can. So thank you for that question. Samantha, you had your hand up, but I think it went down. I'm not sure whether or not you still got a question for us. So Samantha Gallagher.
Hi, I don't know if you can hear me, can you?
Yeah, can do. Yeah, perfect.
It was just in response to how to insert the date into the letter. There was one letter that was attached to the email for us to send out to parents, and it was just a Word document, and it just had the blank spaces. So I literally just typed the date in before I sent it out. That was it.
Lovely. Oh, that's really helpful. A real practical solution for us there. I always love those. Thank you, Samantha. That's really good. Okay. So is there anything else for the comms team, my comms colleagues who are on the call? Is there anything that we just want to share? I don't want to drag this out and keep you from whatever you would normally be doing on a Friday afternoon, but you know, this is our opportunity to get information to you. So I'm going to kind of just test it. Cami, you've just come onto screen there.
Yeah, I think we've covered everything. Obviously, in the letters that we sent, there is a telephone line if you've got any other further questions around any of the logistics. So yeah, and we've sent you links in the letters as well for the national information, so that you can forward that on in the letters that we've done for parents as well.
Thanks, Cami. And we've got an offer from Laura there to answer any public health questions. They're much broader than we can answer from an NHS perspective. So Harry,
I just wanted to learn, because obviously I do work for the local authority, but my main role within that is public health consultant. So if it's local authority questions about enforcement and other things, I might have to defer, but public health, I'm all over it if anyone's got any questions.
Excellent. So we've got other opportunities for webinars, if there, or anything. If there's anything that comes up over the weekend, you kind of reflecting on what you've heard today, anything, oh, I should have asked that, then please drop us an email and we can answer anything specific. We don't want you to be out there worried about it and feeling like you're on your own. So we can definitely support you. But oh, how many children can you get through in 15 minutes then? That's a technical one there, Sarah.
Yeah, that's a very, very good question. It depends. I mean, it's really difficult to answer, if I'm honest, because you'll be amazed what you won't, but you can, all sorts can happen in schools that can change the flow. You know, you might have a vaccinator that needs to go home poorly. The other day we had a fire alarm. You know, it's really difficult to say, but what I would say, not to avoid the question, but what I would say is, you know, the sooner we start, the slicker we are, you know, we can really get through. And I mean, some schools, what we'll do is we'll work through their lunch hour, so they'll stagger the children so we can carry on vaccinating. And then also what we have been doing is kind of saying to schools, would they be happy if we stayed a little bit after the school finishes, so we can, you know, if those children aren't being bussed home, we're happy to stay maybe another half an hour. So it really is difficult to give an absolute answer, but we do our very best to vaccinate as many as we can in a safe way.
So I think I'm right in saying, Sarah, one vaccinator can probably do a child in 5 or 6 minutes, but then we've got the 15-minute observation. Absolutely. That you talked about in your presentation. So we've got to factor that in. But really slick process to get children through. And obviously, if we've got any that are upset, who don't like needles, those sorts of things, they're going to delay it.
We actually allow sort of more like 10 minutes, you know, and then obviously sometimes it doesn't need that, but sometimes it does, and sometimes it needs that little bit longer. And I think the emphasis has to be on safety reassurance. You know, we're working with children and young people here, so you know, we really need to be nurturing and make sure that they have as good experience as possible, really. We're very skilled at that.
I've seen it in the adults as well. We've got adults who are scared of needles. So good. Okay, so it's 3:55. close the seminar then, the webinar then. Like I say, if there's anything comes back to you over the weekend or next week that you're concerned about, just drop us a line and we'll respond. But thank you so much for your support in this. We really couldn't do this programme without you, and it's definitely an important programme that I'm really pleased to be able to join up with schools and do this. And Cammy's popped in the chat, yeah, don't forget to share the webinars that we're doing for parents and young people as well. So we've got webinars next week, we've got dates for next week where we've got the opportunity. If we've got any parents or children who are a little bit anxious about it and want more information, we can talk them through that. Okay, have a lovely afternoon. Thank you, everybody.
Thank you.
And take care.
Thank you, bye.
We're still recording, I see, so I'm not going to.